I did this video in May 2022 called Trump Supporters Will Bite Their Nose Off to Spite Their Face. This video is about American healthcare and how white people vote against American healthcare system that they so badly needed. I ask that you go and check out the full video.
What do you think we should do?
This is my main criticism of Obamacare, of the Affordable Care Act, is that the subsidies aren't as high as they probably should be for a lot of working people. So the two things that we could do that would really make it work even better for people in Kentucky would be, number one, provide more subsidies to folks who are working hard every day but still find the premiums, even with the subsidies, hard to meet. The problem is that that's not what's being proposed by Mitch McConnell, the senator from Kentucky.
Forming a caravan and heading for the border. This chartered bus will travel from Minneapolis, Minnesota, across the border to Canada for a shopping excursion meant to draw attention to a crisis in the United States. The aim of the passengers to buy stocks of the life-saving drug insulin. Insulin prices can be 10 times more expensive in the US than Canada.
$1,200 a year per person on prescription drugs. That's more than anywhere else in the world. 1 in 4 say it is difficult to afford those costs. Both political parties are now looking to tackle that problem, but with some different approaches. As William Brangham reports, the Democrats in the House went first today by passing their own bill. The bill is passed.
It's an ambitious plan to change the government's role in the cost of prescription drugs, costs that are becoming prohibitively expensive for many Americans. The bill aims to lower the price tag for prescription drugs, partly by overturning a 2003 rule that blocked the federal government from negotiating most Medicare drug prices.
Imagine for a moment popping a pill before bed that costs about $13.50. Now imagine waking up the next morning, find that the price of the exact same pill jumped to $750 overnight. That is just what happened to one drug.
Thank you, Brian. And Martin Sperley joins us now from the NASDAQ. He's the CEO of Turin Pharmaceuticals. Martin, thank you for joining us.
Thanks for having me.
Now, you guys have said that the reason you increased this price so much after acquiring the drug was in order to do the research and development to develop a better version of Daraprim. I just got off the phone with an HIV doctor who told me they don't need a better version of this drug. What are you doing here?
Minnesota state lawmaker Lori Halverson, who herself has type 1 diabetes, says the legislation is critical.
We need this to live on a day-to-day basis. I don't get through a day without my insulin. I don't get through an hour without my insulin. We're a captive audience. We have to buy this drug. We don't have a choice. And so to gouge people who don't have a choice is unfair. It's unethical, and we need to make
2003, who was the president? Bush. 2003, Bush Medicare law prevented the government from negotiating Medicare prices, from preventing them from putting the cap on these pharmaceutical companies, raising the prices exorbitantly without no real explanation. That was the Republican Party then push. And as you see, medication has done nothing but skyrocketed in the US. The US pay more for medication than any other industrial nation, but has the most pharmaceutical companies because they can scam the American people because the Republican Party is participating in that. The Republican Party is in on it with them, and poor whites will vote against their own self-interest. Let's be clear, poor whites are voting against Medicare for all, and they are uninsured. If the government provide it, then blacks can receive it too. If we receive it through our job, we can discriminate against blacks and not allow them to get it. This is the format and the process and the thinking of white people. Why do you think they want their health insurance tied to a job that they fear is going overseas? Jobs that they are scared are leaving, they want their health care tied to, rather than have their health care tied to their government.
So what a lot of companies do is raise venture capital funding when they see an important market for a drug, rather than raising the price on the current patients who need it to survive and who have no other choice but to take it and pay the higher price. Why wouldn't you go that route?
Well, we did raise one of the largest Series A financings in history for a biotech company. We raised over $90 million. And we also feel that this is the more appropriate price for Daraprim. At this price, Daraprim is still actually on the low end of what orphan drugs cost. And we're certainly not the first company to raise drug prices.
There is a reason that we pay nearly 4 times more for prescription drugs than other industrialized nations. They use negotiation to lower drug prices. We don't.
Republicans say it will hurt competition and shrink the number of new drugs entering the market. Congressman Kevin Brady of Texas.
People want more cures and lower drug costs. They don't want more cheap political shots. We do, as Republicans, oppose H.R. 3's government price setting regime because it will kill life-saving cures for Americans.
The House bill is not expected to pass the Senate, but the 50-page bill proposes 3 major changes. It lets the government negotiate Medicare prices for dozens of drugs each year, including insulin. It caps out-of-pocket costs for Medicare patients at $2,000 per year, and it forces drug makers to give rebates to the government if their Medicare drug prices rise faster than inflation.
What Medicare for All will do is save the average American substantial sums of money.
The U.S. already spends more money on healthcare than any other developed country compared to the U.S. And what reforms may be coming? In 2018, the United States spent around $10,500 on healthcare for each of its residents. The United Kingdom spent around $4,000. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die. Germany. Here's how they did it. In 2017, U.S. healthcare spending came to around $10,200 per capita. In Germany, it was a little under $6,000. Overall, Germany spent about 11.2% of its GDP on healthcare, while the U.S. spent 17.1%. Germany manages to cover 100% of its population. In the United States, about 8.8% of the population remains uninsured. That comes to about 28 million people, with even more people underinsured. Despite spending less, Germany has better or comparable health outcomes to the United States. In 2017, it's estimated that Canada spent around 10.4% of its GDP on healthcare. By comparison, the United States is estimated to have spent about 17.2% of its GDP that year. The OECD estimates that Canada spent around $4,500 USD per person in 2017. In the United States, though, the figure is expected to be at least double that, at $10,000 per person. Out-of-pocket spending is also lower in Canada. On average, Canadians spent around $650 USD per person in 2016. The average for Americans was around $1,100 that year. And childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher. Studies show that in Germany, there were fewer deaths that could have been prevented with proper access to care. In 2013, there were 83 avoidable deaths out of every 100,000 people in Germany, while the United States had 112. Life expectancy in Germany is 2.5 years higher than the United States, and the infant mortality rate is lower in Germany, with 3.3 deaths per 1,000 live births, as opposed to 5.8 deaths in the United States. Additionally, the maternal mortality rate in the United States is more than 2 times higher than in Germany. Researchers looked at the rate of deaths that could have been prevented with proper access to care across 11 countries. Canada ranked 7th on the list, while America was last. We can see the same trends in infant mortality rates. Canada outperforms the US, but other countries like Sweden and Australia have much lower infant mortality rates than Canada. Canadians also live longer than Americans. Canada's average life expectancy is among the highest of all the countries and is nearly 4 years higher than the US. Additionally, Canada's maternal mortality rate is almost 4 times lower than that of the United States, and more Americans die of heart disease and stroke than Canadians. So how does Canada manage to spend less money than the United States while having a more effective healthcare system?
In Canada, everybody has the same treatment. It would drive them nuts if George got better health care than Sam did. That's not acceptable in Canada.